Good morning. This class today that we're going to do, stretch and strengthen. A lot of these movements that I do involve testing your range of motion, and I feel like that's one of the big problems with people's pain today, is that most of the issue is mostly because they're just not getting the range of motion on any typical day that they need. I ask some patients how often, in fact, they think they lift their arm over their head on any given day, and most of them say once or twice because, well, you got to put your shirt on and off, and that's about the only time they lift their arm over their head. And if you're sitting at a computer all day long, then your range of motion is not being challenged. In fact, being stuck in one position is probably the worst thing for you. And the muscles in a lot of areas will shorten. Some of the muscles will also atrophy just from disuse. So that's what this class is about today. It shouldn't be terribly challenging, but it's a little bit more than just a stretch. So for beginners that are just wading into the pool of strength training, this is fine. This is a good introduction. Nothing very difficult in this class as far as I can recall. As I'm looking at myself in the camera, I just noticed I have to take that picture down because I'm going to be using the wall. We're going to use the wall. We are also going to use a rope, which I don't have at the moment. We're also going to use a rope or a strap. So have one handy. In fact, I'm going to be back in 1 second and go grab one real quick. So this is from a robe, a fleece robe that we just have in the office here. A belt works, a clothesline works, whatever you have handy. And situate yourself not too far away from a wall. Hopefully even like a corner would be good. So let's get started. As usual, we're going to start with our up dogs, but we're going to change them a little bit. So get on the floor, put your hands in push-up position, press up, and then I want you to hold this position as best you can, and I want you to shrug up and down. So try to keep looking forward. I know usually what we do is we hold and we breathe. Today, I want to work these muscles around the shoulder blades a little bit more. So I'm not going to focus too much on breathing for this one. I'm going to do, about 10. And then I'm going to take a break. And then I'm going to do maybe 10 more. So that's about the process that we're going to do today. Usually I'll do a 3-breath pattern, and usually I'll hold that and then take a break and then repeat that 5 times. But some of these movements are not all that difficult. 3, 4, 5, 6, 7, 8, 9, 10. Good. So that's a good example of an exercise where there is some stretching and some strengthening. Keep in mind that once muscles are warmed up, they're a lot more likely to be able to stretch better, and stretching cold is not always the best way to do it. So if you can use the muscles and then stretch them at the same time, you'll save yourself a little bit of time. I don't have my usual camera setup today. We're going to alter this just a little bit. This is working pretty good considering. Yeah, that looks pretty good. I know I can just barely see, you guys can just barely see the bottom here of the screen, but this should work just fine. So lay down on your back, put one foot above the other, so both knees are initially bent, and then straighten just one leg. Whichever leg you have straight, drop both legs down to the opposite side. And I really like to alternate. I hate doing a bunch on one side and then a bunch on the other. I like to alternate because it starts to bring out, it makes a lot more obvious asymmetries. Asymmetries in flexibility, asymmetries in strength, and these asymmetries are at the heart of most dysfunctions that we observe in the office. So the dysfunctions drive the pain, the asymmetries drive the dysfunction, and whatever positions or movements that you typically find yourself in throughout the common day, those positions and movements will drive those asymmetries. So you have positions and movements, asymmetries, dysfunction, and then pain. So somewhere along the way, if you can change one of those things, you'll oftentimes improve your pain levels. If you can reduce the asymmetries, move more, vary your positions, and vary your activities. You'll note that I'm not even counting on this one. I don't expect you to fatigue, but keep doing a few more. If this seems too easy, do both legs straight up and then down to one side, straight up, down to the other. I'm just going to do a couple more like this and then call it good. Maybe one more. Okay, so that was stretching and strengthening some of the muscles in the hips, those that do external rotations like some of the glute muscles, many of the glute muscles, and some of these erector spinae muscles in the low back, and those have to work in conjunction in order to perform motions like that. Next, what I want to do is challenge the groin muscles, stretch and strengthen, and how they combine with the abdominals in making these movements happen. So, we're going to start off in the same position, knees bent. I want you to bring one leg up, and then drop that leg down to the side slowly, and make sure that this knee doesn't move. How far should it go? I don't know. Go as far as it'll let you. And if you're doing it slow enough, you should be able to prevent this from happening. Meaning, if the knee that's bent is moving, that means your whole pelvis is moving. I want your hips and pelvis I want your pelvis to be stationary while this external rotation of the hip movement is going on. Again, I'm not going to focus too much on breath right now, but please make sure you're breathing. If you're unaccustomed to doing exercise, if you haven't done anything in a while, that's great that you're with us here today. But know that your body's tendency will be to hold your breath. I cannot emphasize that enough. I'm not going to make you do any specific breathing pattern for most of these, but I will keep mentioning breathing. I've been to enough classes, particularly yoga classes, where the instructor is shouting at the top of their lungs to breathe, and yet I can see half of the class is clearly not breathing. I can look around and see half of them are turning beet red and just waiting for the moment to come out of the position, waiting for that moment where they could finally exhale. So again, I have no idea how many that was. Honestly, I don't care too much. There's no law that says you have to do 3 sets of 12 of every exercise. Sometimes that's a good thing to do 3 sets of 12. Sometimes, if the exercise is more challenging, why not do 3? Why not do 5? Why not do whatever you feel like you can do that day? I can guarantee you that if you go into an exercise thinking I have to do 12, you're going to focus on that number instead of the movement. You're not going to be paying attention to what your body's actually doing. So constantly monitoring how you feel, constant monitoring what position your body is in, and ask yourself during these positions, can your body go a little further? Because these exercises are not about total strength. These exercises are more about challenging your range of motion and getting a little bit more out of what you have. So, next exercise, still on your back. Bend up one knee, bring it to your arm. Bring the other knee to your chest. I'm sorry, scratch that. This is not to your chest. This is to your armpit. You keep going. Lay down on your back. Bring the knee to your armpit. If I was on my back, this is what it would look like. I can't exactly tell. Like I said, I don't have my normal setup with the camera today. But it should look like this, not like this. If you don't think about it, I guarantee you'll bring that knee to here instead of here. This is going to stretch out the hip in a much more anatomically correct position, and that's going to allow you to use the glute muscles a lot more effectively and spare your low back muscles. Most low back problems, I contend, begin in the hips. And if you can spot the problems ahead of time, you can keep tabs on these things. People want to know oftentimes that there's a solution to their problem. And unfortunately, what they're thinking is that their bodies are broken and their bodies need to be fixed. What they don't realize is that they need to be constantly engaging and monitoring their bodies in as much as checking these asymmetries, checking to see their range of motion, keeping tabs on their tight muscles, keeping tabs on their weak muscles. And if you're not sure if you're tight or weak, go see a chiropractor who has some knowledge in exercise. There's a lot of good PTs out there. There's a lot of good personal trainers out there too. But you know, some are better than others. Let's go to stand up in this position and This is almost too simple, but I just want you to raise your arms up into the air. Lean your body back, but keep your arms straight as you can. So try to think of this as from the palms all the way down, your body is, the arms are straight compared with the body, straight in line with the body, straight vertical, and the head and torso are leaning back slightly. Once you have that position, try to reach up and then try to breathe. This one, the breathing really is important. Not as easy as it looks. Sometimes the hardest exercises can be the easiest if you pay attention to the details. Arms up as straight as you can. Lean your torso back. Point your nose up to the ceiling. If you find yourself developing vertigo, just reach up as high as you can. You don't have to tilt your head back. But do try to push as high as you can. Get those fingertips really high and then get your breath. That's the challenge. Anybody could lift their arms up. A lot of people can't lift their arms up as high as they can. And then breathe. That's good. We're going to do that one more time. Okay, next exercise is going to be the wall side bend. So lean your body up against the wall. The feet should be about an inch or two forward, away from the wall. Your upper back should be touching, your head should be touching. Lean your whole body to one side. Hold and breathe. This is a classic example of one of those exercises where your body will lie to you. I can't tell you how many times I've told a patient to bend as far as they can, and they go, and then I say, is that really as far as you can? And then they go an inch more. And why is their body reluctant to do that? That's a great question. I don't have an answer, but that's what the body's tendencies are. So being aware of them is the best we can do. 1, 2, 3. Again, this one's surprisingly difficult, even for people who are in shape. And if you're saying to yourself, this is not hard, I guarantee you, you're not bending as far as your body actually will allow you to. Also keep in mind that we're doing this up against the wall in order to keep the motion into one plane, meaning left to right. What I'm getting at is, without the wall there as a guide, many of us would probably involve a little too much twisting. We've lost touch with our bodies to the point where I can't really say twist your body because they're going to add some side bending, and if I tell them to bend to the side, they're usually going to involve some twisting. We all know what side bending and twisting are, but for some reason, when that command goes from our brain to our body, something gets jumbled up inside. One, 2, 3. Okay, moving on. We have, this is a new one. It's not all that difficult. Put your hands up against the wall. I'm going to put my hands up against this countertop here. What I want you to do is lean into it a little bit. Put some body weight into it. Straighten out, actually I want you to lift one leg, and then straighten out the knee of the leg that's supporting you. Keeping that knee straight, lift the heel. It's not as easy as it looks for a lot of people. In fact, some people are surprised at how weak one of their ankles has become. And oftentimes, the symptoms are on that side, meaning the weakness in the foot and the ankle has led to issues like plantar fasciitis, or hip pain, or even knee pain. This is one exercise where I do a bunch on one side and then do a bunch on the other. It's just a little simpler that way. Do focus on keeping your knee as straight as possible as you lift your foot. Scratch that, as you lift your heel. So what I typically see is this. What I want you to do is this. See if you can separate those movements and really challenge your foot and calf muscles into a full range of motion. Next set we do, I want you to do the same thing, but lean a little bit more so that as you come down, you get a little bit more stretch in the calf. Pause at each position. Pause at the top, pause at the bottom. Pause at the top, and at the bottom. Well, as usual, I already lost count. I think that's probably about 8, maybe somewhere 8 to 10. 2, 3, 4, 5, 6, 7, 8. 1 for good luck. Okay. This one I think we've done a long time ago. We're going to modify it a little bit. I call it the wall butt bump, meaning the ultimate goal is to push your butt up against the wall as you stand maybe a foot away from it. So take 1 foot's distance away from the wall. Stand up straight. As you bend forward like a bow. Try to keep your back as straight as you can. So this instead of this. Keep your back straight. Stick your butt backwards at the same time. You see at the end there, I actually had to lean into it just a little bit in order to touch. Eventually, we should be able to barely touch it without having to lean or fall into it. That was good. This is called the wall butt bump. I call it also hip hinging, meaning the movement should occur at your hips, meaning the ball and socket joint, instead of in the low back. Why is that? Well, you have much stronger glute muscles than you do low back muscles, believe it or not. And teaching your body to use those glute muscles is essential for sparing those smaller muscles in the low back. Now, those muscles in the low back are there to stabilize, so it's not like they get zero activity, but they're much better at stabilizing than they are at being the primary mover of motion such as this. So if you think about it, this is like a deadlift. And if you've seen guys at the gym or power lifters in the Olympics perform a deadlift, the best ones are able to get down pretty low and still keep their spines relatively straight. The more they round, the more they're going to risk themselves for injury. If this is getting easy, take a tiny step forward and challenge yourself again as far as the range of motion goes. Good. Good. Don't forget to push your hips forward as you come up. At that. There you go. I'm going to add a little bit of arm push just because it makes it a little bit, gives it a little bit more resistance for the low back muscles and for the hip muscles. Yes, I'm doing a lot more repetitions of this one. I'm doing it because it's a pattern I want your body to become very familiar with, and it should become second nature to hinge at the hips than to rather slouch. So there you go, wall butt bump. Continuing along with the glutes, we're going to do just a simple squat. And I know that people are thinking to themselves, but Dr. Schaefer, my knees. Well, relax. You squat every day, dozens of times. And all I'm asking is to do what you would do throughout the normal course of a day, but with a little bit more thought involved. So ultimately, I'm not telling you how far to go. I am saying go as far as your body feels comfortable. Hold and take 3 breaths. Good. Now the second set, see if you can go a little bit lower. Maybe you can, maybe you can't. Good. And just so you know, we're only going to do the 3 breaths 5 times. But I want you to try to challenge yourself and go down a little bit lower every time we do the 3 breaths. 1, 2, 3. Good. This is hard for a lot of people because their bodies are saying to themselves, hey, my torso needs some help staying stiff to stay upright. And what your body usually wants to do in these situations is hold your breath. So by adding the breath, 1, 2, 3, it becomes much more of a challenge for the average person without risking injury. Okay, we're going to move on to a side lunge / stretch. So, feet, bring them out wide. Don't be afraid to bring them out wide. If you have shoes on, it's no problem. If you're in your socks on a slippery surface, you just want to take those socks off just so you can get a better grip. So shoes are fine, bare feet are fine, socks don't work so good on this one. Keep the feet straight forward as much as you can. The second you stop thinking about it, one of these feet is going to twist out, guaranteed. So feet straight forward, feet nice and wide, lunge to one side. You'll notice I'm not going all that far at the moment. Good. Same thing as with the squat. Try to get progressively further and further. Watch your knees. See what the knees are doing. Most people, if they have a knee problem, their knee's going to buckle in like that. I want you to push the knee out. Don't twist the foot out. The knee should come out without the foot twisting. When that happens, you'll feel a greater stretch. So this knee is collapsed. This knee's a better position. I'm going to feel more of a stretch on that groin. I want you to try to do this staying upright with your torso instead of bowing down. Again, it adds a little bit more stability. Challenges your core a little bit greater. Good. Keep watching those knees. Make sure your feet are straight. Like I said before, sometimes it's the simpler movements that can be the most difficult when you pay attention to the details. Good. Moving on. This is where we start to get the strap or the rope out. Grab your foot. Make sure that the leg is not out here, but here. Once you have that, then try to get the knee behind the other knee. Again, make sure that you're not flaring. Keep it nice and tight. Push the knee back. Hold, take a few breaths, and if you're doing it right, you might even feel a stretch in your shoulder here. If that felt good, go ahead and do the other side just like that. If you're having a problem with this one because of flexibility issues, grab that strap, go onto the floor, lay on your side on the floor. While you're on your side on the floor, hook the rope or strap around your foot. Slide that rope or strap to the ankle and then pull it towards you. Again, make sure your hip doesn't flare out. Try to get the knees as close together as you can and then pull that leg behind you as much as you can. Sometimes you'll be here, depending on your flexibility, sometimes the arm will be here. But again, just make sure that the knees are close together as you're doing this one. If you're doing it on the floor with the strap, continue to do the 3-breath pattern. One more time on this side. Hook the strap around your foot. Get onto your side. I don't really care what your upper body's doing, I'll be honest. This is just the easiest position for me. Knees together, make sure the knee doesn't want to flare up. And bring that leg back a little bit as you bring the heel towards your butt. I'll be honest, I don't feel much with this one. So I'm going to do a couple more of the standing version. If the strap works best for you, you keep doing the strap. We'll do a few more. Either way. Again, if you want to use the wall for stability, that's not cheating. Just do me a favor and don't put all of your weight up against the wall. Just put a fingertip or some fingertips up against the wall. There's a lot of research to suggest balance is an overall good test of physical fitness. At least it's one part of a good test. And as your balance goes, so your physical fitness, and so does your, you get an increased chance for being in pain with the worse your balance gets. That's what the research is saying. Again, if you're unsure, the knee should be close to the other knee. The heel should be coming to the butt. Try to get this knee past the other one, but doing so without leaning your body forward. If you're leaning your whole body forward, you're fooling yourself into thinking it's stretching when you're ultimately just changing the angle of your torso. This one's important because these hip flexors shorten when we sit. And I will contend that the vast majority of us sit too much. Maybe we sit at the computer, maybe we sit to drive, maybe we sit for leisure, but it all adds up. Moving on, we're going to use that strap again, and we're going to stretch the shoulders and triceps. So, I'm going to double up this fleece thing because it's not all that strong. Flip it over your shoulder with the other hand. Pull it down. You should feel a nice tug right there. Should be stretching your triceps. This is going to be like a push and pull a little bit, where you pull with this hand down, and you should feel the tug on the top arm and should feel a little bit of a stretch in the triceps. Switch sides. Maybe you can tell my left shoulder is a bit tighter than my right. That's always been the case. Well, not always, but I think it has to be with being a chiropractor. But most things that we do throughout the day are asymmetrical. Being at a computer is inherently asymmetrical. Operating a car, motor vehicle is asymmetrical because you have accelerator, brake on one side. As your right leg moves around, your body tends to contort and do things in order to compensate. Living in an asymmetrical world is not the worst thing in the world, but like I said before, it helps to keep tabs on these asymmetries. And that's why I feel like exercises like this are important, because I can feel my left shoulder a lot more than the right one. And you know, if I was stretching out at home by myself, I would probably stretch out this left one twice as much. I would still do the right one, just not as much, because I'm not getting as much out of it. If you're unsure how long to hold this one, the 3-breath pattern works pretty well for this one as well. I think we just got 1 or 2 more exercises here for you. Pull that rope overhead. We're going to do another side bend, just a variation. You get a little bit more latissimus stretch in doing this one. And holding the arms overhead actually is a little bit more difficult. Keep that rope tight, not here, but there. You'll feel it more if you do. You don't have to do this one up against the wall, but do try and note that your body's going to want to cheat by bringing the top arm forward. So try to keep it in line with the head. Try to keep the head in line with the rest of the body. Your head should be hovering over your foot, not out in front of your foot. Again, look at your head, see if it's hovering over your foot. Keep your nose going straight forward. Good. 3 breaths. 1, 2, 3. 1, 2, 3. Good. One more time. 1, 2, 3. 1, 2, 3. Okay, this class is a little bit longer than most, but I think I want to do one more. Yep, I got to move the camera here. This is a corner. What I want you to do is just a bicep stretch. We've done this before. I'm going to move this chair out of the way real quick. We've done this before. This is just a stretch, really. In fact, for this one, I would prefer that you keep it relaxed as possible. Make a fist. This part of your fist is going to touch the wall. I want you to lean your whole body forward. Turn your head the opposite way. For this one in particular, I do not activate the muscles. So this one is not a strength, and this one is just a stretch. I like this one a lot, though, I'll be honest with you. I think a lot of us, our biceps are shortened because of being at the computer and or driving all day long. If you don't have a cornered wall, you could do this in the doorway. Try to keep the elbows straight. Try to turn your nose the opposite direction. It's another good one to count your breaths. Now you should be feeling it, this part of the elbow, maybe up into the biceps, maybe into the forearm. But if you're not feeling it in the shoulder, try to turn your body to the side a little bit. You should feel a little bit more tug into the shoulder, maybe even into the pec. Keep it nice and relaxed. Don't thrust the shoulder up. I guarantee you some of you are doing that right now. Okay, other side. Focus on your breaths. Keep the shoulder nice and relaxed. In fact, wherever that shoulder is, push it down just a little bit more just to be on the safe side. Good. We're going to do one more time on each side. Okay. So that's it for our stretch and strengthen class today. I hope you enjoyed it. If you did, hit that like button. If you haven't already, so hit the subscribe button if you're watching this on YouTube. I usually post them to Facebook and then do a Facebook Live and then transfer over to YouTube. I think people are on Facebook more, and so they're more likely to say, oh, Dr. Schaefer's doing a class, maybe I'll join. But you'll see this class listed as probably the only stretch and strengthen class, or the one that's marked stretch and strengthen, on the YouTube page. If you haven't been to my YouTube page, just Google or just YouTube Andrew Schaefer, Chiropractor, Schaefer as S-C-H-A-F-E-R. And if you're not sure if it's the right Andrew Schaefer, you should see my picture and the big blue bridge in the background to say that yes, this is Grand Rapids Schaefer Chiropractic. So I hope you enjoyed the class. If you did, hit the like button and tell me if there's anything you think we could do better, or if you have any questions, shoot me a private message. I'll be happy to answer those questions. Enjoy the rest of your weekend. Be safe. We'll see you soon.